Hi there, my name is Megan, and I'm going to be presenting with my colleagues Kajal and Meiji. We are all second year pharmacy students at Ohio State and want to thank American Society of Consultant Pharmacists, or ASCP, for helping us with this presentation. We are going to be presenting on bone health and you, a brief guide to promoting bone strength. So here are a few statistics about bone loss. More than 300,000 hospitalizations per year are due to hip fractures. 95% of these fractures happen by falling, and women experience 3/4 of all hip fractures. Falls and fractures are not a normal part of aging. Bone loss and fractures are one of the more preventable conditions that affect older adults. We worry about bone health because hip fractures are very hard to recover from and can reduce your ability to remain independent. However, there are some proven ways to help reduce bone loss and the risk of falling. Here are a few of the major risk factors for bone loss. As you can imagine, there's not much we can do about getting older or menopause, but we can certainly help with drugs and disease. We can also reduce and manage bone loss no matter what the cause. There are some people who should definitely have their bones tested. If you fall into one or more of these categories, getting your bones tested is something worth talking to your doctor about. The major categories include women over 65, postmenopausal women who have a history of fractures, have recently stopped taking estrogen, or who have had one or more risk factors mentioned in the slide. It probably goes without saying that older age and family history of bone weakness increase your risk of fractures. Exercise is very important to bone health because your bones can actually get stronger and stay stronger from doing weight-bearing exercise. Women do have a higher risk than men, and Caucasian and Asian people have the highest risk of fracture, while African Americans have the lowest. And what kind of pharmacy students would we be if we didn't talk about drugs? It is very important to add that the risk from the medications listed on this slide can be managed, and that everyone should not stop taking their medications without first speaking to their doctor. These medications treat very serious illnesses. If you take any or several of these medications, you will need to work extra hard on keeping your bones strong and monitor them with tools like the bone density scan. The drugs in red are those we are most worried about, while others have conflicting evidence. So the ones listed in red are those long-term steroids, the anti-seizure medications, and the transplant medications. And then now let's talk about some chronic diseases that play a role. If we go to the next slide. Any autoimmune disease, which is a disease where the body attacks itself, like Crohn's disease or rheumatoid arthritis, increases your risk of a fracture. Whatever illness you may have, the better you manage your illness, the less likely you are to have bone loss because of it. Once again, these illnesses are not definitely going to give you bone loss. It's just important that proper bone health is taken seriously with people that do have these illnesses.
As listed on this slide, some of the diseases are type 1 diabetes, rheumatoid arthritis, Crohn's disease, like stated before, any gastrointestinal diseases. Some manageable ones are alcoholism, poor nutrition, and then eating disorders. Some other ones to watch out for are kidney or liver disease, or any organ transplant, or an overactive thyroid. So low estrogen and testosterone, Cushing's disease, cystic fibrosis, and hemophilia are also other risk factors, just to name a couple more. If you are very worried about your bone health and you do not have any of the risk factors that we just talked about, it's probably still worth having a discussion with your doctor. So you know that you have one or two of the risk factors for broken bone. Now you want to know exactly what your risk is. One way to help to estimate your risk is the World Health Organization fracture risk assessment tool called FRAX. FRAX is used to determine 10-year risk of hip or other fractures. It can help identify who needs treatment or lifestyle changes. If your risk of fractures is high, your doctor may recommend what is called a DXA scan, which measures your bone mineral density. Where there is no direct measurement of bone strength, a bone mineral density or BMD is the closest estimate. BMD alone is not enough to predict who will get fractures, but combined with the factors mentioned previously, it can be useful in predicting who is at the highest risk. Your insurance company will probably pay for the DXA scan if you fit into any of the categories that were mentioned earlier. So this is what a DXA scan would look like in progress. We would usually take the DXA scan of the hip and the spine. The whole process itself takes about 30 minutes, and it's quick and also painless. This is a table of just looking at the bone density scores or so, called T-scores. If you're above -1, you're in the normal range, but if you are below that, you may have some issues with your bone density. So it would be good to talk to your doctor more so about this. So now that you know your level of risk, what can you do to improve your bone health? Making certain changes such as fall prevention and proper calcium and vitamin D intake, along with medication in certain cases, can help improve your bone health significantly. So fall prevention is the most important part of avoiding fractures. If you don't fall, you probably won't break a bone, even if it's not that strong. Regular exercise also helps maintain agility to steady yourself when leaning or falling. Exercise doesn't have to mean running a marathon or lifting weights. It can be as simple as walking around the neighborhood or even a walk around your house. Balance exercises such as Tai Chi are also very helpful. Anything that make your bones hold you up will help keep them stronger, just like your muscles. If you only take one piece of advice from this whole presentation, you should exercise regularly if you want to keep your bones healthy. So looking more at home, you can wear supportive low-heeled shoes with good traction rather than floppy slippers or socks. Carpets should also never slide, so consider placing a skid proofing on the carpet, or at least placing heavy tables on top of any throw rugs so they can't slide. Good lighting is also critical. You would want a 100 watt bulb, and at least flashlights if you're leaving the bed at night. Using handrails in the bathroom or on stairs, installing 2 handrails on the stairs is the best. Keeping cords out of walking areas, or using even cordless phones and other items when possible.
Okay, so let's move on to supplements. And first we'll take a look at calcium. Calcium is the most important ingredient in maintaining bone health. It can be found in a lot of foods, not just milk and dairy. Less well-known sources include sardines, clams, and collard greens. For a full list of calcium per serving for many foods, please refer to the handout that's going to be linked in this post. Just as it is bad to have too little calcium, too much can also have problems like loss of appetite, nausea, vomiting, constipation, kidney stones, kidney damage, or increased risk of heart problems. That's why it's important to estimate how much calcium you eat normally before adding more. There are 2 common forms of calcium supplements, calcium carbonate and calcium citrate. Calcium carbonate should be taken with a meal or acidic drink to be more well absorbed. Calcium citrate is recommended for people taking certain kinds of antacids or medicines like Prilosec or Nexium. Normally, adults over 50 need 1,000 to 1,200 milligrams through both diet and supplements. If you and your doctor feel it is best for you to take 2 tablets a day of calcium, be sure to separate those doses by taking 1 tablet twice daily. This will help for your body to be able to absorb more calcium at each time. We also recommend drinking plenty of water, eating foods high in fiber, and regular physical activity to prevent constipation. And next, we'll take a look at vitamin D. Vitamin D helps you use your calcium better. Even 15 minutes of sunshine without sunscreen in the spring or summer will help you get your daily requirement of vitamin D. This is definitely the best way to get vitamin D because you can kill two birds with one stone and go for a walk while you're outside. Too little vitamin D can cause rickets, muscle weakness, bone pain, and greater risk of falls, all of which translates to more fracture risk. Too much vitamin D has many of the same negative effects as too much calcium, so don't overdo it by taking more than 1,000 international units a day unless directed by a doctor. Supplements containing much higher levels can be used in the case of a documented deficiency or in conditions like irritable bowel syndrome, where vitamin D is poorly absorbed, but most people don't need them. Here in Ohio, the winter months do not provide enough sunlight to successfully generate vitamin D, so adequate dietary intake is crucial. 600 units is recommended over age 50, and 800 units is recommended for those over age 70. Now we're going to talk very briefly about prescription drugs to treat osteoporosis when calcium and vitamin D aren't enough. When the previous steps are not enough to prevent osteoporosis, your doctor may prescribe you another kind of drug. Some of the most common prescription treatments are a class of drugs called bisphosphonates. These include the drugs Fosamax or alendronate, Boniva, which is abandronate, Actonel or risedronate, and Reclast, zoledronate. And just some final notes to summarize. Good bone health can make a very big difference in a person's quality of life. Proper calcium and vitamin D intake are an important part of keeping your bones healthy and strong. You need at least 1,000 milligrams of calcium and 600 units of vitamin D each day. Fall prevention is the best way to avoid breaking bones, so keep living areas well lit and uncluttered. Remember, exercise is a crucial part of any bone health plan too. And now we're going to answer a few common questions. So the first question is, how much calcium should we be getting every day? It's recommended that all individuals get at least 1,000 milligrams of calcium per day through diet and supplements. Women over 50 and men over 70 should get 1,200 milligrams per day. Another question is, what kind of weight-bearing exercises can we do? So weight-bearing exercises help to reduce the risk of falls and fractures by improving agility, strength, posture, balance, and increases bone density. Some examples that you can do are walking, jogging, tai chi, stair climbing, dancing, tennis, weight training, and resistance training. And you may be wondering, how can I help my children or grandchildren build strong bones? So it's important to help your children get enough calcium and vitamin D so they are building strong bones while they're young. Encourage your children to have a balanced diet with sources of calcium and protein. Milk and other dairy foods are among the richest and most readily available sources of calcium in the diet. Educate them about the importance of weight-bearing exercises and the negative effects of smoking and excessive alcohol on bones. It is also important they understand that having a healthy body weight, like no-crash diets, will help to build strong bones. Tell your children that beauty is bone deep and no one should be obsessed with thinness at the expense of bone health.
If you have any further questions, feel free to go visit Powell Pharmacy and speak with Emla. She's the owner and a pharmacist there. We are located at 4004 Presidential Parkway in Powell, Ohio. If you have any questions, there's the phone number and the email below. Thank you so much for joining us for our presentation today, and I hope you learned a little bit more about fall prevention and bone health.